So my name is Dr. Hakky. I am a urologist and I specialize in andrology, the study of male sexual health, and I practice at Atlanta Cosmetic Urology, and we're located in Buckhead and Atlanta.
Those are a lot of huge words that you have just used. Can you break that down for the normal, typical understanding of regular people?
So I'm just a dick doctor.
Dick doctor sounds more understandable.
Yeah. And it didn't matter if you're cisgender or transgender, we just fix your dick.
Mm-hmm.
So you fix the dick?
Yes.
Oh, okay. And who is this lovely lady next to you?
This is Kiki.
Kiki's your assistant?
No, Kiki's the blood draw.
Yeah, I'm technically
Blood draw?
Yeah, I don't work for him. I work with him. So, but I'm your right hand man technically right now.
Right hand woman, yeah. She draws all the blood for all the tea.
We do everything.
A lot of people need her to draw blood and stick them.
How long have y'all been working together?
2 years. About a year and a half.
So this is a fresh relationship.
Mm-hmm.
Yeah, it's fresher, yeah.
It's fresher. Oh, okay. And y'all enjoy working with each other and everything.
Yeah.
It's all love.
Even though he blames stuff on me though.
Except for when she can't draw blood, it's bad.
Oh, wow.
It's bad shit, dude. Patients don't like it. When she has to stick them.
And where do you stick them?
In the arm? I stick them in the penis.
Oh, we do IVs, everything.
Oh, that sounds so fun.
Yeah.
And you enjoy your job.
Yeah, I like.
Somebody's got to draw blood, man. Somebody's got to fix your penis. Sure, our website is a nice way for you to get started. You can look at other curved penises or fat and skinny penises or shorter and longer penises on our website. Mm-hmm. And it's AtlantaCosmeticUrology.com. AtlantaCosmeticUrology.com. The other options, you can call our office when we're open at 404-400-3120. That's 404-400-3120. And, you can make an appointment. We can talk about it. I usually like a lot of drawings. I'm a visual type of guy. Most guys are. I like to draw on the screen about what we're doing, how we're going to fix your dick, and how we're going to make it better. This is serious. It's really private. I usually make it so that we have private parking access. Mm-hmm. We have a lot of people that are in places and people that that come see us that have this problem and have a lot of problems, right? And so we try to make sure it's an open environment. We don't judge based on race, gender, sexual orientation in any way, shape, or form. We come in because we want to fix your dick. So I guess when you come see me, you got to fill out a bunch of paperwork. It's a pain in the ass. Put you in a room. Kiki draws your blood to check your testosterone because 20% of the time, low testosterone has caused erectile dysfunction. 80% of the time, it's another problem. So it's either vascular, blood flow in, blood flow out, or psychogenic, like you psych yourself out, or it's dick scar tissue, or there's something else going on, like medicines.
Psychogenic and you psych yourself out. What do you mean by that?
So what seems to happen, younger guys is you think, oh, I'm going to lose my erection, I'm stressed out, and you're not focused on what's at hand, right? And then you lose your boner. That's basically about it. If you're not focusing on what you're doing, then you're going to lose your erection.
Okay.
Right? There are other factors, right? Other medical factors that can affect the blood flow, like diabetes, smoking. There are other problems, right? So the 4 reasons for you to go see a doctor as a dude is going to be 1, for a well check, 2, for high blood pressure, that causes erectile dysfunction, 3, high cholesterol, that causes erectile dysfunction, and 4, diabetes, that causes erectile dysfunction. So the 3 of the 4 common reasons for you to go see a doctor, any regular doctor, is ED.
You didn't say the PSA.
I couldn't hear you. You didn't say what?
Another one too.
Doesn't cause erectile dysfunction.
Oh, right.
Yeah, it's just for cancer screening.
Oh, okay.
I screen a lot of men for prostate cancer.
Uh-huh.
We have a lot of patients that are high risk. A lot of black men are high risk. So we try to lower their risk of prostate cancer by getting them to ejaculate about 15 times a month and getting to be mostly vegetarian. So, you want to decrease your risk of prostate cancer. And we tell patients, you want to be on a mostly plant-based, fish-based diet 80% of the time. And 20% of the time you want to, try to stay away from the other stuff but you can try to stay on red meat. But we like you to be away from that sort of stuff about 80% of the time. Right, so how do you treat erectile dysfunction? So everybody knows about Viagra, Cialis, Levitra, all the pill stuff, right? So what's the next step up? The next step up is stem cells or dick shocks. So this machine right here is the only one of its kind in Georgia. It's a dick shocking machine. You ever want to see one of these before?
So dick shock?
Yes, it's a linear shockwave machine. It's available in Israel and Europe. And your penis gets strapped to this thing right here. It sends sound waves. It feels like somebody's flicking your penis, like, right? And it just like sends shock waves to your penis. It's a clinical trial we have here in the office. It's 10 treatments. About 60% of the men get improvements in their erections based on this. But there's a washout period, right? So after about 2 years, half of the guys lose the gains they make from the machine. So FDA didn't fully approve it. They just said, we want more data. In God we trust, but data is a must. So there's a lot of other jokesters out there that'll do gains wave and shock wave with circular shock machines, which have circular machine heads. They have to go up and down your dick because your dick isn't circular, right? It's a long shaft. So this is flat. These paddles here are flat for your penis. Does that make sense?
Mm-hmm.
If you look at that, it's flat. It's a flat panel. So that's one of the treatments, right? Another treatment is dick shots. And so, like, most porn stars are not telling you this, but they're injecting their penis with trimix and bimix and all this other stuff right here. So we have these medications called trimix and bimix, and you inject your penis with this. The needle's kind of small. I mean, you probably have trouble seeing the needle in the video there. You know, and so it doesn't really hurt. It's a really, really tiny diabetic needle. And so this will open up the blood flow by increasing blood flow to your dick by medically inducing an erection. Right? So another way to get an erection you start to get to the mechanical world. So dick stretching on vacuum. So like this is a dick vacuum, and you can put your dick inside the dick vacuum and it'll suck the blood into your penis, and then you can use a cock ring to leave it in there. Right?
Now, I've seen that particular machine in different sex shops.
Yeah, these are awesome, dude. So your penis is a muscle. So if you want bigger muscles, you go to the gym, right?
Right.
So if your dick is a muscle, you send it to the dick gym.
Ah.
So dick protocol for lengthening is 10 minutes every day for 8 weeks. 1/2 inch or 5% girth.
So 10 minutes.
10 minutes inside this chamber.
Every day.
Every day.
For 8 weeks.
8 weeks, 1/2 inch in dick length.
Really?
Yeah. That's like length you can feel. And your partner will be happier that you're 5% wider. There's
So
no surgery.
It works in girth or just length?
Length. Well, it's stretching in both directions. There's something called the RestoreX machine, which is just stretches like a dick stretcher. Like you could be wearing your RestoreX dick stretcher right now, and you could just walk around stretching your dick all day. You know, this you have to like sit down and just use it. But this is nice because it'll get you in both directions. You just kind of turn it on and then turn it off when you're done. Right? So it's battery operated, but you got to get a cock ring. Now, if you leave the cock ring on for more than 30 minutes, you're probably going to hurt your favorite limb. So there's dangers here.
So it's like overworking it. And the cock ring is holding
You're
the
just
blood
like
there
choking off the blood, yeah.
Right.
But you don't want to choke off your favorite limb for too long.
No, not at all.
Yeah,
Not
so
at all.
the problem with the cock rings is you need blood supply to your penis. And the other way is surgically curing you. All the other treatments we've talked about, they do not cure you from erectile dysfunction. So this right here is a surgical cure. Basically, do you like breast implants?
Yes, I do. I love breast
If
implants.
a good breast implant
good
looks
one.
amazing. Yes,
Right.
yes.
A
If
good
they
one.
look fake, like, and they're just like this, it doesn't look good. But a good breast implant, when done well, serves, and the lady absolutely loves it, and she loves to show it off to you, and you're like marveling at God's amazing creature and the surgical skills of that surgeon. So this is the same concept, but for your dick. So instead of 2 cylinders in the chest, it's 2 cylinders in your dick shaft. Inside your ball sack is a pump, right? Like those Air Nikes from the 90s.
The D Browns.
That's right, man. That's right. And so you pump this up inside your ball sack so she doesn't know or he doesn't know anything. And then the fluid leaves this hidden reservoir chamber next to your bladder, and then you get an erection. So basically, this doesn't change orgasm. It doesn't change sensation. It does not change ejaculation. It makes you as hard as you want, for as long as you want, with whoever you want. Now, the PSI, or the pounds per square inch of this device, is 1,000. Your best erection at 18 was 900 PSI. So this is more powerful than your penis at 18.
Wow.
And what's even, this is the mind fuck right here. Your dick is either hard or soft in the world you lived in.
Right.
When you go to your girlfriend, she's like, he's not ready yet, right? This is variable hardness. Better than anything in any toy store she can get is what's in your pants when you have this. Because she can pick what she needs based on whatever you want. It's like a light switch. So you turn it off when you're done. right? So this is what we use in cisgender men because they got bigger scrotums, right? So give me the one for the trans.
Which one?
Right there. So if you're transgender, we like to use this one.
No,
But if you're transgender, you only have one cylinder. Kiki, can I see your forearm? So in transgender, wrong arm. In transgender men, we use the jerk off muscle, which is right here. See this? You're not looking, bro. Jerk off muscle. The brachioradialis muscle, and that's how long Kiki's penis would be. And we would put that down into the pubic area, and that would be her penis. So she'd probably have a flower tattoo on her dick if we was to do this.
Wait.
That's the muscle we use to make the penis.
So we use this part right here.
You would take that?
That would be her dick length right there.
So
Okay.
She'd have a, well, no, it'd just be that long. It wouldn't make it this fat, but we just use this muscle right here. If you use this muscle right here and take the skin from here to here.
What will replace that muscle?
Nothing. We just flap the skin over top, do a graft on top of there, and she'll be missing the jerk off muscle. She won't be able to jerk off with her left hand. So then there's only one cylinder that we put inside the transgender men.
Okay.
Right? And so this pump's a lot smaller. So if you show your viewers, right, that pump's a lot smaller, right? So it's much easier to sit in a neoscrotum with this.
Okay. That's making sense.
Right? So then they just pump up their one cylinder and then they're good to go. And then when she's done, he's done, he can squeeze it down, or she can squeeze it down, the partner, whoever she wants, can squeeze it down and take it back to flaccidity again.
So a transgender man
Yes.
that was born a woman and then had a process to be a man.
Female.
Yeah, we took all the female organs out. I don't do that part.
Gotcha.
And then we take the jerk off muscle from the left wrist.
Gotcha.
Right? And then we
and
put that down there.
down
Then you
there.
create a neophallus. Then inside the neophallus we put in this, and inside the ball sack we put the ball. And so then they have a ball.
So you create a sac?
Out of the labia. Out of the labia.
Out of the labia?
Yeah. You just put in like a neoscrotum, and then we have them suck on it for a bit. With like some vacuums and stuff to like expand it out.
And then you have them suck on it for a bit.
Yeah, just to stretch it out and stuff.
Okay.
And then we put the pump in there, and then they have the cylinder in the shaft. But they only get one cylinder. They don't get two.
Right. They don't. I mean, well, why do men need two?
Because they have two corporal bodies. Your penis is actually an erector set. It's actually two pieces snapped together. You've got basically a huge clitoris with a head on top of it.
I've heard that's viral on the gram now that men have nothing but a huge clitoris.
Mm-hmm.
Yeah. That's all it is.
Actually, it's the other way around, that women have a small penis head.
Yeah.
Oh, okay. So
it's all the same stuff, just put in a different way.
The two balls are connected. They snap together to the... for a man, that's what I'm saying.
For a man, for a transgender or cisgender?
For a cisgender.
Cisgender men would have two cylinders like this, connected up with a pump connected into the ball sack and a reservoir next to the bladder.
Okay, and since they don't have actual balls, that's why they only need one particular...
We like this because it's smaller. Look at the silhouette of the two pumps, right? So if you're looking at the two pumps side by side, right? Side by side them. Right, this one's smaller silhouette. If you've got a short, tight scrotum, right, and it's a neoscrotum, it's a lot harder to get this into, like, it's a lot harder to get this one, inside the neoscrotum than this one.
Now, will age matter? Because as a man gets older, does it get smaller? So
no, your balls get saggy as you age, bro. You don't have to worry about that. This shit's gonna sag on the floor and get in the toilet bowl when you get older. But the transgender men don't have much ball. Because there's nothing there.
There's nothing there.
Right? We got to make a little sack and then we got to fill it with this. So it's super tight in there.
So ladies, pay attention to the balls.
So there's another company. So this is like, most of my patients like this one because it's super wide. I mean, like each cylinder, you know, this comes in standard sizes, 14, 18, 16, 20, and 22. My average size implant's 22. It comes in XL 24, double XL 26, triple XL 28, right? And they get bigger and they get wider as they get bigger. You can see these cylinders are about 23 millimeters in diameter. See that? That's girth she can feel.
Yeah.
Yeah, or he can feel. Let's not be sexist here. You know? And then there's another company here. Can you show that? This one we use for skinnier penises. So this one is AMS company.
Dr. Hakky.
Yeah.
Who has the smallest penis?
Japanese men.
Japanese men. So
Yeah.
we use those for those.
Yeah.
Okay.
Chinese and Japanese men.
Okay. What race will have what? Does black people get this more or?
Yeah. Usually black men have bigger penises, so usually we tend to use this one more. But if we were in China and stuff, like when I was operating in China, I showed them this device, the smaller one of this, smaller one than this, and they freaked out, dude. They're like, does it come in smaller sizes? I was like, absolutely, because they're just smaller people, I guess. So this one is the skinnier device. You can see that this device, the American Medical System CX device, is a lot skinnier. You can just side by side the two here. We'll inflate this one just for posterity purposes, so you guys can feel better about it. So then you can see that this one device is like a little bit skinnier than that one, but you know, you have to size people what they need. Now I'll tell you the pros to this one is the button's a whole hell of a lot easier to find. So if you have like arthritis or you have a skinny penis, this is a better device. Right? If you want a big fat penis and you want to be rock hard, then you gotta go with fatness. It's like a tree trunk or a twig.
Okay, so I'm understanding it now, because first it's like, wait, this is so mind blowing, seriously. But now it's like, okay, I can see that. I can't see it, but it's a surgery, and that goes inside of your fucking penis.
Yeah, your dickhead's on top of here.
Wow, like that is just mind blowing.
Yeah, and she's nothing she can do. Like she can do whatever she wants.
And
nothing like boom,
like
boom,
yeah,
boom.
you're doing it like that, but it's like you don't even see how that's inside your penis, dude.
Yeah, it's awesome. And then if you want to decrease the amount, if you want to give her more bending ability, like more twerk.
Right.
You can like take it down a bit like I just did, and then she can just get more twerk on it.
Oh,
So
man.
if she's riding, if she wants to do
Right.
and everything else,
Yeah,
it doesn't
you
hurt.
can give her more. Or you can, but then see, here's another power that these guys get when they get this. They can control orgasm. You can't. Right? You can try to control, but you can't. Right? So the more pumps you put on this, the longer you go.
Really?
The less pumps, you go sooner. Because this is pushing on nerve endings, which run on the top side of the penis. So if you look at the pictures, right, nerve endings run along the top side of your dick, right there. See that? So if you have a nice wide prosthesis and that pushes up on the nerve endings and the blood supply, it's going to feel like the keys in your pocket. Do you know they're there? You kind of forget after a while.
Right.
So it's going to kind of deaden. It's going to kind of deaden the nerves in the air, because it's not going to make you numb, but it's going to kind of push on the blood supply and the nerves. It's super stretching it. Right.
Oh, okay.
And guys, as they live with these things, you know, they get bigger penises as they age. Now, your penis, if you don't get one of these put in, will shrink as you age, because you'll stop using it, and that's like a death knell for penises.
Right.
So, as far as this goes, there's 3 downsides. Right, all those upsides, there's got to be some downsides. Number 1, you can't go back. You can't go back to dick shots. You can't go back to dick shockings. You can't go back to Viagra and Cialis. It's over for you.
But you don't really need that.
I mean, you shouldn't, but I mean, if you ever wanted to know what it was like to do a dick shot, it's over.
Okay.
Done.
Can you still get pregnant?
Yes. 2, the device itself has
10
10-year life expectancy, right? So you've got to be mentally ready for every decade. Yes, you can have unlimited sex for 10 years, but your ass is going to be back around to find Dr. Hakky or somebody else to fix your ass, to put a new one in you.
And you don't plan on retiring, though.
I hope not soon, you know. I got bills to pay, you know. Shit, dude. Then the third thing is this implant, if you watched very closely as I was cycling the device, it doesn't get longer like your natural wood does. It only gets wider. So you're going to lose 1/4 inch. So how do I counteract the length lost by putting this in? I have all my patients vacuum their dick before we implant them. My average size prosthesis that I put in is 22. This. Why is mine greater than the U.S. average? The guys that walk through my door in my office have bigger dicks than the U.S. average of 18. They just walk into my office and poof, their dicks are bigger? No. I have them think ahead. I make them stretch before I put this in. So if they get 1/2 inch and I shorten them by 1/4, they got a lot slightly bigger. And they're like, hey, dude, I made out better. I had a broken dick, and now it's bigger, wider, and I can use it.
What's the age limit? I mean, the age ranges that you usually receive?
I mean, I've done this on a guy that was 19 who had sickle cell disease and was having like priapisms or erections that never go away for like 10 hours. You know, and I've done it on like a 96-year-old ballroom dancer.
So 96 was the oldest.
Yeah.
96, and he was a ballroom dancer.
Probably why he lasted so long, because cardio, right? So
Right.
what can you do for good dick health or good erection health?
Great question.
It's going to be number one, eating right? I mean, like, we have too much sugar in our diet. We eat way too much red meat. It's really limiting that, right? The second thing is cardio, right? Because heart is going to send blood to your